Hello everyone, Dr. Charlie Johnson, physical therapist at Physical Therapy in Johnson, and I want to take a moment to talk to you about the main types of shoulder pain. So there are a lot of common causes of shoulder pain, but a lot of times they can be boiled down to sort of fitting into one of these four categories, okay, and sometimes more than one category, okay. So here we go, okay, so there are four types of shoulder pain, and the first type of shoulder pain is a shoulder that is weak and painful. So just meaning that the structures in the shoulder can't quite handle the load or the weight or the resistance that everyday life, such as reaching and lifting, places upon it, okay? So the tendons sort of become weak, and therefore they become painful. So this can include many diagnoses. The overarching diagnosis would be like a shoulder impingement. So maybe you've been told you have shoulder impingement. The other thing would be like a rotator cuff tear, or full tear, partial tear, or sprain. A bursitis. A tendinitis or a tendinopathy, which is like a chronic overuse or degeneration of the tendons in the shoulder. Biceps tendinitis also included here, and then any problems with the labrum, or with sort of this seal or this structure in the shoulder that helps the shoulder be a little bit more stable. Okay, so all of those things will be included under a shoulder that is defined as like a weak and painful shoulder. Okay. The other type of shoulder that we could have is a shoulder that's stiff and painful. All right. So you should ask yourself, hey, does my shoulder feel stiff? If it does, and you say yes to that, then chances are that it is stiff, and it might fit into this category. Okay. Some of the common things that fit into this would be arthritis in the shoulder. So maybe you've been told you have osteoarthritis or arthritis, and or a frozen shoulder. Okay. The third type is what we would call maybe an unstable shoulder. So this usually occurs in people who are younger. Maybe you feel like your shoulder kind of pops out of socket or is a little bit loose in the socket. You have maybe excessive flexibility in kind of all other areas of your body, not just your shoulder. Maybe you're double jointed. You can kind of touch your palms or touch your elbows to the floor and do kind of all kinds of crazy moves, right? But you just feel like the shoulder isn't quite stable. So you could ask yourself, does my shoulder feel stable? If it doesn't, then chances are it could be unstable, all right? And then the final type of shoulder pain will be a problem that's actually not coming from the shoulder at all. It's where you're feeling it, but it's actually a problem in the neck. So either with the joints in the neck, some of the discs in the neck, or some of the nerves that send signals to the neck, okay? So that's absolutely a possibility. And again, with these four types of shoulder pain, you can literally ask yourself, okay, does my shoulder feel weak? If it does, you might have a weak and painful shoulder. Does it feel stiff? Does it feel sort of loose or unstable? And or do I have shoulder pain, but I also have some neck pain, and perhaps they're related? That might hint at the neck being the root cause of your shoulder pain, okay? So if you've been diagnosed with impingement or something with your rotator cuff, or you just have shoulder pain that won't stop and you're looking for relief, reach out to us, 484-552-3767. We'd love to help you out. Thanks.